All right, guys, hey, it's Rick Bigger. We're going to go over the ventilator today. This class can be watched and used for your March training to cover ventilation. So you have two 1085s coming up for March. One is ventilation and one is capnography. This can cover your ventilation CUs for the month. Okay, so this particular class is over the basic vent operations. So we're going to cover AC mode in particular, how to set the vent up, how to put your initial settings on it, make your adjustments, and troubleshoot. First, going over the key terms that you need to know to be able to work the vent. Okay, so the first term is PIP, P-I-P, which you see. PIP is your peak inspiratory pressure. The easy way to think about that is a high pressure alarm for your lungs. Okay, so that is going to be a key thing that you need to understand to be able to adjust the vent. The next is PEEP. Okay, think of PEEP as inflation assistance. It helps your lungs re-inflate. You have to remember that somebody that has not been breathing, their lungs are completely collapsed. So we have to slowly inflate those again, and it takes a while for them to get back inflated. PEEP assists with that. The last one that we need to understand is tidal volume. Tidal volume is easy. It's the volume of air that's going into your lungs. It's the measurement for that. Okay, so those terms will be used a lot. Some people don't understand what those mean. They're very important when using the vent. So for the vent in general, I drew a picture over here. We're going to talk about it. I'll use this to show this. If you have your ventilator when you're watching the training, you can have it in your hand and you can be looking directly at your vent. We drew a picture so it's easy to see there too. The initial settings on the vent. Okay, so as I said, we're going to use this in AC mode. So you'll see on the ventilator, it's labeled AC and it has a V in parentheses. The V stands for volume. Okay, so what that means is the ventilator is going to deliver your tidal volume, which you're not familiar with this. The V with the small t, that's the abbreviation for tidal volume. It's going to deliver a certain tidal volume with a PIP alarm. So it will deliver air until it reaches that tidal volume, and you have your PIP alarm as your high pressure alarm. Next is BPM. I set these up when you're looking at your vent. It goes from top to bottom. So when you turn your vent on initially, the AC mode's at the bottom. We're going to go through these top to bottom in the order that you would set them up when you were working the vent, the easiest way, instead of bouncing around. Okay, next is breath per minute. That will default to 12 whenever you turn on the vent. Next setting will be tidal volume. Okay, so when you first turn your vent on, it'll automatically default to 450. Okay, so to talk quickly about that, and we'll get into a little more later. I drew a little mathematical thing here that probably makes no sense to you, but we'll go through it real fast of how to calculate the range for what your tidal volume could be. Okay, so the easy way I like to do it is I take my height. So I'm 6'3", and then I'm going to add a 0 to the end of that, and then divide that by 2. Okay, so the top end, I take 6'3" and add a 0, gives me 630. That's the high end of my tidal volume. And then I divide that number by 2 and I get 320 or 315. That's the low end of my tidal volume. So if I flip that around on my vent setting, if you were to use a chart for your 4 to 8, that's the setting. So this is my low end of my setting, and this is the high end. So if you look for 450 for me, that starts right in the middle. That's pretty good for me, okay? The problem with this initial vent setting, okay, is that most people we deal with aren't 6'3". Okay, so if we take the average elderly female that we run on a respiratory arrest, and she's 5 foot, okay, we add our 0 and divide by 2, we get 250, or excuse me, can't add today. We get 500 to 250, right? So our range is 250 to 500. We're already starting on the very high side of that. So this will lead to a common alarm, and we'll talk about that in a minute. So the tidal volume automatically defaults to 450, and you can make adjustments based off of that. If you are quick with math in the truck, you can do your math real quick in your head, and it'll get you closer so you have less alarms later. Next setting is PEEP, going up our up our vent. Next one is PEEP. The PEEP will default to 5 whenever you turn to AC mode in our ventilators. That's a pretty decent setting to start with. Next is your PIP alarm. Okay, the default alarm for the low level is 10 and the high is 35. Okay, so what that does in AC mode, right, if it falls below 10, you'll get an alarm. If it goes above 35, that's your alarm that your airway pressure is too high. We'll talk about the alarm settings in a second, or the alarm troubleshooting in a second. The last one you're going to make is FiO2 near the top of your vent. Okay, right above your PIP, you got your FiO2 setting. It will default to 21% when you first turn it on. When you give air, you're generally going to give between 40 and 100 concentration of oxygen. Okay. I drew this chart here from ards.net, if you want to go in there and look it up and read more about it, talking about the relationship between FiO2 and PEEP. Okay. So what we generally do, what a lot of people do, is they just turn it on and they run with the default settings, right? So you have this, we're going to assume our patient is 5 foot in the example I gave here, the average smaller elderly female. Okay. So we go with the default to 450, we leave all the default settings alone, and we put the vent on 100% of FiO2. Okay. If you look at the chart here, to think about PEEP, okay, if we're having to give somebody 100% concentration of oxygen, we need to increase our PEEP. Okay. What most people will try to do is leave the tidal volume very high, use a high level of concentration of oxygen, and it leads to alarms on the vent because you're giving the person too much oxygen. There's not enough room, or too much volume of air. Okay. So this is a chart here. Easy way I remember it is that anytime I go over 21%, which is room air, right? Anytime I make my adjustment, my PEEP's at 5. Okay, that's your standard. If you're using room air, you're using a PEEP of 5. As I make the adjustment, anytime the level of concentration of oxygen doubles, the PEEP needs to double. Okay, so if I went from 30 to 60, my PEEP doubles to 10. Okay, if I went from 25, we'll say roughly, if I go all the way up here to 100, I increase my oxygen concentration by 4, so I increase the PEEP by 4 to equal that out. Okay, so most people are never going to use a PEEP of 20, which tells me that we probably shouldn't be using concentration of oxygen 100. Okay, so there's 2 ways to do this. Kind of generally, what most people do is start on 100 and then they wean the patient down. You can start with 100 like that, leave your PEEP at 5, see what your results are, and then you can wean the patient off of it. Okay, but your goal should be the goal should be for the concentration to be lower than 100 before you get to the hospital, unless your patient requires it. Well, these kind of initial settings that we can run with, if you just want to run with the defaults, that's absolutely fine. And we'll talk about making adjustments based off the patient next. Okay, so when you want to make adjustments, I set up my ventilator, and I'm going to use my little picture here, and you can do it on your vent if you want. Okay, so initially setting it up. So first we're going to put our settings in, right? So straight on the vent right here, my breaths per minute defaults to 12. I put my tidal volume at 450. My PEEP is 5. My PIP alarm will be 35 to 10. That's a default alarm. It's going to automatically be on there. And let's say we have our FiO2 at 100%. It'll look just like that on your ventilator. Okay. So setting the vent up, I got the settings on there. Now I need to make the connection. Okay, so this is your vent circuit. This is the patient end, obviously. Got our tubes, we come down to our end. It has 3 different tubes on it. One is big and blue, okay? On the top view of the vent, this is exactly what the top view looks like. The big blue one, it's gonna go right here on this black one. So you'll have the transducer here that's green. You have the oxygen supply hose, which is green. And you have a tan colored one on your vent. Okay, that's where that goes. That plugs in directly to there. Okay, your other 2, these are simple because one's green and one's clear. The green one goes to the green one. The clear one goes to the not green one, the tan one. Okay, so very easy. So if I was to put these on, that one would go there. The green transducer plugs onto the green transducer. My clear one plugs onto the only one that's left. Okay, so it's very simple to set up. If you flip these backwards, you'll get alarms right away. Okay, it won't work. The other things that are on top, okay, this is for SpO2. We don't use it. That's why it says NA. And this right here is your AC plug-in for your power. Okay, that's what those are. It's easy to set up when you put it on top because they can't really fit anywhere else except these 2 can be backwards. Just remember, green always goes to green. So we have that set up, we got our patient hooked up, we got our settings in, and we start working. So how do we know it's working correctly, and how do we know how to adjust? We're talking about adjustments. I look at 3 things to show me that the vent is working. The most important, right off the bat, is what did my SpO2 do? Okay, so I hooked my patient up. She was in respiratory failure. I intubated her for some reason. We're using AC mode. Okay, so the first thing I need to know is did the patient respond to me giving them oxygen? Okay, is what I'm doing working. Okay, so this says 88% to 99%. There. So what that goes for, generally we think of it as like 94 to 100 or 94 to 99. Okay, what the 88% for is if you have a patient that lives at that level normally, you have severe COPD, okay, or somebody that's been down for a long time with COPD, and you can't make them get any higher, they probably live at that number, okay, and they're going to be okay. 88 is the low end, okay? Generally, what most people are looking for is somewhere between 94 and 99, okay? Somewhere between 94 and 99, right? We should all know why we don't run it to 100, or if it runs to 100, we need to start making adjustments, because we don't know what that number really is. Could be 101, could be 140, we don't know what it is, okay? So 88 to 99 on a COPD patient, 94 to 99 on everybody else. Okay, so obviously you just have to assess your patient, what was their condition before, what's causing this problem, and that will let you know if they're doing okay. Okay, so if my SpO2 is going up, if I think about it on a basic terms, I put a tube in their throat because they weren't breathing. That tube is in their lungs and I'm putting air in there and the SpO2 goes up, I'm doing something right. Okay? Next thing I look at is end-tidal CO2. It says 35 to 45, which is your standard, right? Your standard reading that you're going to get. That's obviously going to be adjusting based on what kind of patient we have. There's a lot of conditions, respiratory and metabolic, that can cause that to be different. Okay, but that's my goal. If I'm looking at what before I drop this patient at the hospital, I would like to be in that range. Okay, and we can use this. Most importantly, what I use end-tidal CO2 on adjusting the vent is that if I put a setting on here and I had let's say my number was 45 when I first started, okay? And then I put the vent patient on the vent and I breathe for him for 10 minutes and now the number is 25, okay? We have a problem. I'm breathing way too fast, okay? So I can slow that and make that adjustment based on the end-tidal CO2. Or another good example is in trauma. There's another good one. I initially have it, end-tidal CO2 is 60 on a patient that was awake 5 minutes ago. That's not normal, okay? So I can turn the respiratory rate up in order to try to lower that, okay? It's just another thing I can look at that tells me how my patient is responding to my treatment. Lastly is the one for alarms and for lung protection, okay? We remember that PIP is our high pressure alarm. So we are forcing air into somebody's lungs, so we have to be careful about how much air we put in there and how high the pressure is, or we'll cause more damage than already done. So the PIP low end is 10 and high end is 35. The only time it is different is during cardiac arrest when you're actively doing CPR. Okay, so if we're actively doing CPR, we have to adjust this number and we run it up to 100, right? So we select that button and run our PIP up to 100 because we are forcing the chest down during CPR, so we're making that number go up and the PIP alarm can't work, okay? But we're assuming we're not in cardiac arrest, and that number, this high number tells us if our tidal volume is too high, okay? Or we need to suction the tube, we have a problem with how hard we're forcing air into the lungs, how much pressure is in there. So, let's say I hook the patient up and this number is 60, okay? That tells me a couple things. We'll talk about troubleshooting that. That's one of our common alarms here in a minute, but it tells me that I'm probably using too much tidal volume, okay? So if the container's only so big, I'm putting too much volume in there, I'll get a high airway pressure alarm. And I can adjust that down, okay? So where most people run into problems, the first problem they run into is how do I make adjustments and what do I know how to do? Okay, so let's assume I drew this chart here to describe these adjustments are proportional to each other. Okay, so if I have to turn one down, I can turn the other one up to make up, okay? So if I have a tidal volume of 450, I have a respiratory rate of 12, and I'm using my FiO2 chart correctly, and I have an FiO2 of 40 and a PEEP of 8. Okay? But my high airway pressure is 60. And my let's see, my SO2 is 99%, so everything's going good. My cat knows 45. The patient likes it, right? But my PIP is 60. Okay? So right away, you're going to get an airway pressure high alarm, okay? Because your airway pressure is way too high. Okay? But everything's good as far as SpO2, but I need to make an adjustment because I could pop a lung if I don't. The pressure is way too high. So I need to adjust the tidal volume down. Okay, so very simple. Make an adjustment on your tidal volume. Let's say we adjust it to 350. I realize, hey, this is not good. So I quickly do the chart in my head and I go, wow, I was on the extreme high side of my tidal volume. Let's take it down to 350 and put it close to the middle. So I do that, okay? We have to assume now that the tidal volume is lower, that this 99 is not gonna stay the same. So I'm gonna make that adjustment and then I'm gonna go back to my SpO2 and I'm gonna watch and see what happens. And now I'm just reassessing my patient. I made a change in treatment, so I reassess. Did the SpO2 drop? If it does not, we're okay. I go back to PIP and I see it drop. And let's say that it drops down and it's back into my range. So we don't need to make any more adjustments. I adjusted my treatment, the patient still responded, and we're okay. But what if the SpO2 does drop? Okay. Remember, these are proportional. Okay. So I have choices. Okay. The last one that I like to adjust is the respiratory rate. 12 has been seen to be a good one that has great patient outcomes. So I'm getting less volume, so let me raise the concentration of air. So if I have less volume, I need more oxygen in it. So I make an adjustment, and I move to 60 and 10 off of my chart. Okay? I made an adjustment in treatment, so I go back to my SpO2 and see if my patient responds. Okay? Well, it's pretty simple to adjust this ventilator if you understand how these adjustments work in relation to each other. Okay? We can run into problems. Let's say we dropped it to 350 and I turned it all the way up to 100 over 20 and I don't have any more options on my FiO2, I'm maxed out. But my patient's SpO2 is dropping, it's not working. I can remake another adjustment. Take my tidal volume back to 400. So we go to 400 now. Now say I get a PIP alarm again. Man, what do I do? Okay. Well, we know that 350 was okay because the PIP alarm told us. It told us what the pressure was. So we're at 35 now. We're at the high end of our PIP. So the only adjustment we can make at this point is to raise the respiratory rate. If I have to exchange less air, a less volume of air, I can do it faster. Okay, so we make a slight adjustment to the respiratory rate, go to 14. Okay, so now we're moving less volume, but we're moving it quicker, so the exchange happens at the same rate. So we still have the same minute volume. Okay. I made an adjustment again. I go right back to the SpO2 and make sure that we're good. Okay. After I check my SpO2, I'm like, okay, I'm cool. Everything's working great. Patient likes it. All my alarm settings are great. I made an adjustment to the respiratory rate. So after that, I need to pay attention to my end-tidal CO2 and make sure that I'm not hyperventilating the patient. This is just something to think about. Well, all these are patient response to things. These are what I like to call the results of the treatment. This is how I monitor the results. If somebody asks you, how do you know what you're doing is working? These are the measurements that tell me that it's working. Okay? That's how I adjust. And this little, remembering that these are proportional and I can adjust these makes it a lot easier. Okay? All right, so how do you make an adjustment? We are adjusting. Okay, let's go over that real quick. On the front of the monitor here, top view to set it up, front view to look at it. Okay. So on here, we all know, and if you have your ventilator, if you're watching the video, you can follow along with the vent and make adjustments, right? So we have buttons. There's 7 of them on the right-hand side, and they all correlate, and they have a little line that points to the thing that they adjust, whatever setting they adjust is. Okay, so if I wanted to make my tidal volume change, I push this tidal volume button, and that number will start flashing. Okay, once it's flashing, it's selected. This is my knob right in the center. I use my knob to adjust it up and down, and then I have a little green check mark right here that I always have to push to save the setting. Okay? If you make an adjustment and then you move on without the green check mark, it will not change. Okay? So if you're practicing, if you're not familiar with the vent, make sure that you play with this because this is a common thing that we miss. Okay? Well, making our adjustments with that. Last one, troubleshooting common alarms. Okay, this probably, besides adjusting your settings, this would be the most common question that I get personally about vents. You get a lot of calls, people, I ran this call and I had this alarm and I couldn't make it stop. Okay, so I've kind of went through these and came up with the most common ones that I see or get questions about and how to correct them. Okay? So most common alarm that you generally see on calls that I've seen in my own personal experience is airway pressure high. Okay, that's your number one alarm. So I see it right here, it says orange. That means it's a medium priority alarm. The vent can still work with that. The patient is not in immediate danger, but it needs to be adjusted. If your vent is alarming all the way to the hospital with the orange alarm, you have a setting problem that needs to be adjusted. Okay, so we just talked about this in detail, airway pressure high. What that means is that my PIP is exceeding the high end. Okay, so as soon as I see that alarm, I go to my vent and I look, and you have your high end here. And right next to that PIP name, it's going to give you the actual number. It says 45. That's what it's reading. That 45 exceeds 35, so it alarms, and it gives you this airway pressure high alarm. Okay, we just talked about how to fix that. I need to adjust my tidal volume and adjust my settings. Okay? That's how you fix airway pressure high. If I make an adjustment to my tidal volume, I change it, and I'm still getting this, it probably means that there's an obstruction in the tube. Okay, that's the second thing. On airway pressure high, the next thing that can cause the high PIP is needing to suction the ET tube. Okay, so if you look at it, you're like, hey, my tidal volume is perfect. I know I don't need to adjust it. I'm right in the middle. I know I'm good, or I'm already on the low end. But I look at my tube and it's full of blood and throw up. That's the problem. Okay, I need to suction my tube. Okay, the obstruction in the tube is causing that. Airway pressure high. What's the last one? All right, so the next is, are you actively doing CPR? Something to remember, okay? A lot of people forget to adjust this during cardiac arrest. So they put the vent on the truck and it immediately starts alarming for airway pressure high. Okay, so if you're in cardiac arrest, this number 35 needs to be changed to 100. So I need to select it until 35 is flashing, run that to 100 and make sure I hit my green check mark, and that should deal with that alarm. Okay? Second one, high breath rate. Okay, this is a common one. I've had 2 or 3 calls here recently about this one. Okay, I was going to the hospital and it kept alarming and telling me I had a high breath rate, but when I looked at my breaths per minute, it wasn't high. Okay? There's also another thing that you'll notice on the front of your monitor, okay, is it shows you the breaths that the monitor is giving, right? It gives you those, or excuse me, on the front of the ventilator. It'll show you what you're putting in, okay? Then under end-tidal CO2, when you have this breath rate, if I go to my end-tidal CO2, the next thing I can use it for, you'll see nice, pretty breaths that you're giving. And then in between those, you'll see random small ones, okay? So the ventilator's reading each of these breaths. So you're giving 12 breaths, but the patient's breathing between those, causing that actual rate to be higher. So if you look at your monitor on your breath rate, it'll be 24, 26, 30, but you're only giving 12. So the reason that's happening is because the patient is not properly sedated. They're breathing around the tube. Okay? This is a very common alarm that you see. It's very easy to fix. Okay? If you're breathing for the patient, they don't need to be breathing on their own if you have a tube for them. So you need to sedate that patient more in order to take their respiratory drive away so you can control it. And this high breath rate will go away. Number 3, patient disconnect. Okay, you see this is a red alarm. If you turn your ventilator on right now, it will give you a patient disconnect alarm. And this right here at the top, this is your alarm. You got red, orange, and green, and it's currently green because my vent's set up and it's working correctly. This big box will turn red, be flashing, you'll get an audible alarm. Okay, this means that your tubes are disconnected. So follow troubleshoot it. I like to troubleshoot it from the vent to the patient. So right away I look, make sure this is still connected, make sure these are still connected. Okay, if they're still connected, you're okay. Follow down the tube, make sure you haven't ripped it in 2 pieces. Everything's still connected where it's supposed to, and the top of this is still attached to the tube. That will fix your patient disconnect alarm. Number 4, low O2 supply failure. Okay, so this is also a red alarm. The reason this is a red is because you've told this to get a certain amount of oxygen and it can't do it. Okay, so as soon as you turn this, when you first turn your vent on, you'll see a number 21, or excuse me, I'm sorry. That's SpO2. In FiO2, you'll see a number 21, which we all know is for room air. Okay, it can deliver 21. The second I take that above that, and I don't have this connected to oxygen, it will alarm low O2 supply failure. So if I tell it to give 40, but I don't have the oxygen attached to the truck or to a bottle, it'll immediately give you a low O2 supply failure because it can't deliver that level of oxygen you're telling it to. So when we see this low O2 supply failure, immediately make sure the vent is attached to the oxygen tree in the truck or your bottle. If you have it attached to your bottle's probably empty. Okay, so you check, make sure that it's connected. As soon as it's connected, make sure there's actually oxygen in the bottle. Okay? If this happens, you connect your supply, you realize I'm out of oxygen. You're still okay. Just turn this back down to 21 and give the patient room air. Okay? So go to 21%, give them room air, check your SpO2. You can still deliver ventilations with that. You just only do it at room air. You can no longer give them extra oxygen. Okay? Number 5, apnea alarm. Okay? This is also a red alarm, so apnea means nothing's happening. There's no breaths. It's not detecting any breaths. Okay? As soon as this happens, immediately find out if that's true. Okay? The easy way to find out if this is actually true or it's a ventilator issue is to look at your end-tidal CO2 on your monitor. Okay? Look at it. If you see your end-tidal CO2, it's still plateauing, you're still getting breaths, it's still breathing. Okay? The monitor is not detecting something. If you disconnect one of your smaller tubes here, if you disconnect these on the top of your monitor, you can induce this alarm. Okay, so right away, when I have apnea, check my end-tidal CO2, make sure the ventilator is still working. Okay? If it is still working, to alleviate the alarm, recheck your tubing again and make sure these are connected. These get settings and that let the vent know what's going on. So recheck those. Okay, if the apnea alarm continues, you need to disconnect the patient and use a BVM. Okay, this is a red alarm. The monitor or the ventilator will stop if you continue with this alarm. It has to be fixed. Okay, same with O2 supply. Same with patient disconnect. Okay, the ventilator will not work with red alarms. If you have a red alarm, you have to fix it. So that's all your stuff from key terms you need to know, initial settings to put on the vent, how to make adjustments, putting those into the ventilator, and then troubleshooting your common alarms. If you have a different common alarm that you're running into or something you've seen, call me. I'll talk you through it, and I can adjust the video so everybody has that information. Hope this helps. This is only for AC mode. We'll put another one together for CPAP and BiPAP mode, and we'll put one together for capnography for you guys soon. If you do use this for your training, make sure that you adjust it. If you weren't present with me today, then this is distributed education. Make sure you check that on your box on your 1085. Thanks for watching, guys, and see you later.